Hi, I'm Dana Hoff here at Gulf Coast Plastic Surgery and the Skincare Center with Dr. Jocelyn Leveque. We are going to bring you a new series called the PeriPost, where we talk every Friday about perimenopause, symptoms, and treatments. So there's a huge trend going on social media talking about using H1 and H2 inhibitors to treat symptoms of perimenopause. So I want Dr. Leveque to talk about what H1 and H2 inhibitors are and how they treat symptoms in the body.
All right, well, great. So yes, this seems to be a trend, and then addressing whether is this really going to fix the problem or not. So we talk about what histamine blockers are. So there actually are four different histamine blockers, 1, 2, 3, and 4. But basically what we're dealing with here in this conversation is histamine 1 and histamine 2 blockers. So a histamine 1 blocker is basically one for allergies. So you've heard of the general ones are like Benadryl or Zyrtec or Allegra, that kind of thing. And of course, Benadryl is one of those first generation ones, which really does have more brain effects in the negative way. And then the newer ones such as Allegra, Claritin, that type of thing don't tend to cross that brain barrier as much. But it's basically histamine reacts in an inflammatory type of situation. So if we have allergic reactions, the histamine response is heightened, and these things will block that, and that's what helps with these allergic reactions. So it is kind of like where inflammation occurs, it can help that. And then sometimes what we have going on in the perimenopausal time frame in our lives, some of that is inflammation. So it can temporarily, I think, help these symptoms, which is really just the tip of the iceberg. When we talk about what the problem is, it's not really solving the problem, it's helping symptoms temporarily. And then H2 blockers are like Pepcid or Zantac, and that's really what's blocking the production of acid in your stomach. So this combination for some people seems to be helping their symptoms, but it's really not taking care of the problem. And there are negative side effects to these drugs, especially taking them long term. The H1 blockers, it can actually negatively affect your brain. It can cause dementia after using it over the long term. H2 blockers actually can affect your liver if you're taking them for the long term, and it can affect you. You can have temporarily headaches, diarrhea, things like that. So the most important thing for us to consider is really when we're talking about perimenopausal period in time, what is happening. Our hormones are, first of all, being produced less and less until they're not being produced at all. And the real answer to this problem is to solve the underlying cause of what's causing these symptoms, and that is hormone replacement.
Okay, awesome. Well, thank you for giving us a little window into a very popular trend on social media. We love when our patients ask us about things that they've seen on social media. We hope that we can give you some answers. We are so proud to offer hormone replacement therapy services beginning in August with our new hormone replacement therapy nurse practitioner, Kaylee Gordon. You can call us at 850-474-0155 and get on our wait list to see Kaylee.